Greetings and welcome to Healthy Heart at Dr. Shankar Surgery. The pulmonary trunk is first opened upwards. The initial incision is made with a sharp knife. Here, scar tissue and adhesions are very dense, and care is taken to select a good site for placement of this first incision. The incision is then extended upwards with the use of a pair of scissors. This incision is extended until the pulmonary bifurcation is visible. Then it is extended downwards towards the right ventricular outflow tract, below the level of the pulmonic valve. Here, adhesions and scar tissue from the previous operation are especially dense, and special care must be taken to preserve vital structures while at the same time gaining adequate surgical access. There are blood vessels coursing through the tissues of the right ventricular outflow tract. Care is taken to control the bleeding from these while gaining access to the inside of the outflow tract. Further stay sutures are used to open up the right ventricular outflow tract, resulting in better vision and improved surgical access.